Good morning, everyone, or good afternoon to our online viewers in Asia. I'm Clive Cookson, Science Editor at the Financial Times, in the beautiful city of Trieste to moderate our first plenary of Friday on the key subject of, if COVID-19 is the 9/11 moment for global health, what needs to happen next? We have a stellar cast of the key people in global public health. The format's going to be that I interviewed one of them, the Lancet editor Richard Horton, in London before coming out here, and he has given us a very, very rich set of ideas and reactions to the pandemic. After he's spoken, I will introduce our four co-panelists who will react to what he says. Then we'll have a debate, and I hope that you will send in some online questions on the question bubble on the form, on the page, and we can also take questions here in the hall. So, can we please have Richard Horton's video now? Welcome to Friday morning at ESOF. I'm actually sitting in the London office of The Lancet, one of the world's great medical journals, with its editor, Richard Horton, who has been one of the most trenchant and concise critics of British and indeed the global response to COVID-19. He's brought out a book, The COVID-19 Catastrophe, which I think you finished writing in May. We're 3 months further on now, Richard. How have things panned out? You were very angry, to put it mildly, furious with the responses of several countries, particularly the UK and the US and other European countries, in this book. Have your thoughts, your feelings mellowed at all, or do you think it's just as bad as you did when you wrote this book?
Well, thanks, Clive, and it's great to be here with you. I should say it's only my second time back in the office since lockdown began in the UK back in March. The epidemic has evolved, and I think we do have reason to continue to be, if not angry, then certainly anxious about the evolution. The spread to see major foci in the United States, across Latin America, in India and in South Africa, those 4 areas especially, should give us reason for very, very serious concern. This pandemic is not over. It is still raging around the world, and we are still at very, very serious risk. And I don't believe that we've fully learned the lessons.
And of course, putting the human face on it, in the last 3 months, the number of people who have died from this dreadful virus and the number who've been made ill is vastly greater than it was when you wrote the book, isn't it? It's raging away.
Yes, exactly. And I think that human dimension to this pandemic is one that we're very much in danger of losing. We focus so much on league tables, on death rates, on comparing one country with another, but behind every table are families who have lost loved ones too early. And that's the reason you said at the very beginning that the book was angry. The reason why I think we should be angry is that most of these deaths were entirely preventable. And we should retain our ability to be shocked by the brittleness of the societies that we live in. And that's why we have to learn the lessons from this pandemic.
Well, let's look at how it could have been stopped in brief, because there are many ways where the interventions could have been better. Let's start at the beginning, December 2019 in China. Could it have been stopped in China and not got out to the rest of the world at all, do you think?
I don't believe it could have been stopped in China. One of the unfortunate realities is that Wuhan is a major transportation hub for Asia. And if you look at Gabriel Leung's work that we published at the end of January, you can see that that was in some ways about the worst possible city for the outbreak to begin, because the spread across the whole of Asia was dramatic. We certainly knew, the earliest documented case that I'm aware of was December the 1st, 2019, and we certainly know that in those early weeks when Chinese doctors and scientists were struggling to understand what was happening, sure, if there had been 1 or 2 weeks shaved off the reporting, the first reporting to WHO at the end of December, then it's possible the burden of infection could have been reduced coming out of Wuhan. But I don't believe that it could have been stopped entirely, no. I think that would be a pipe dream.
Yes, I mean, I think there's reasonable evidence, though it's not conclusive, that there were already people travelling infected out of China before anyone recognised it, even the Chinese.
Yes.
Because we have to remember that it is an exceptionally transmissible virus, as well as being virulent in a minority of people. It's very, very transmissible, isn't it?
That's right, and I mean, we know that now, and it's interesting to try and rewind one's thinking back to December and January. And you know, in January, we really weren't sure, was this human-to-human transmission or not? But it did become very clear by about the middle and late January that this was human-to-human transmission. But even then, I don't think we realised just how transmissible it was. And of course, again, the science has evolved. And in particular, the 2 dimensions that's really made this whole pandemic more complicated, the asymptomatic spread, which we were aware of the dangers very early on, but we didn't have a handle on how big a part asymptomatic spread was going to be. And secondly, the importance of airborne spread. And I think, again, the traditional public health science, epidemiology, you needed a different kind of science to understand the notion of these microdroplets, these 5 mu microdroplets that literally are suspended in the air, and that poses an additional danger. So again, the science has been so important to understand the transmission dynamics, but it has changed, and that's, as you rightly say, we now know that it is a much more transmissible disease, much more severe disease than we thought.
Okay, China couldn't have stopped it, I agree with you, getting outside their own country, though they could have reduced the burden probably. How well did the rest of the world react in the early stages, let's say to the end of January, when the World Health Organization declared a public health emergency of international concern? How well did the world do in January?
I think the conclusion of history will be that the world did very poorly. And the reason for that, well, there'll be many reasons to explore for that. But fundamentally, I don't think that governments understood what a public health emergency of international concern actually meant. And maybe that's actually a fault of the public health, the global public health community, of not making that clearer. Because the one lesson that we learned from SARS 2002-2003 was that we needed to strengthen the international health regulations, we needed this public health emergency of international concern red flag to wave, we needed to invest the power in the Director General of the World Health Organization, and that meant that when he or she pressed the button to say this is a public health emergency, governments were supposed to spring up and react dramatically, and they didn't. Nobody did. And that was a shocking misunderstanding of what AFAIC actually meant. So that, unfortunately, the fact that although on January the 30th, a public health emergency was declared, and then nothing really happened until early March for most countries. And that was wasted time.
Yes. Do you think the World Health Organization and Dr. Tedros in particular were too reluctant to call a public health emergency of international concern because of wanting to keep China on side, collaborating?
I think this is a very unfair accusation that's being levelled against WHO. You've got to think about the situation at the time. The Beijing office of the World Health Organization was doing their level best to work with Chinese colleagues to understand what on earth was going on. I mean, nobody fully understood what was going on. I mean, they were sitting in Beijing, this was going on in Wuhan, it was a brand new virus, a brand new disease. Everybody was really struggling with information. And then Dr. Tedros called the International Health Regulations Emergency Committee together. Absolutely the right thing to do. And when the committee came together, they were evenly split about whether there should have been an emergency declared or not. Because there wasn't enough information. We're talking about the middle of January. There wasn't enough information. So then he could have called an emergency after the first meeting. But, knowing what a big deal it is to call an emergency, he wanted the support of the emergency committee. And these people sitting around the table in that committee were world experts. So he waited, and he then went to Beijing to try and understand what was taking place himself. And then there was the second committee meeting. And as soon as the information became clear, he did the right thing. So I think actually, and if you compare the speed with which WHO declared a public health emergency this time compared with Ebola, I mean, this was unbelievably fast. So this is why I think it's very unfair of certain governments to be so critical of WHO and Dr. Tedros. I actually think WHO did an amazing job under the circumstances.
Well, before we go back to what happened elsewhere in February, let's pursue the WHO line. Do you think the WHO has continued to do a good job since the end of January? I mean, is it still working as it should, despite, as you've indicated, certain governments sniping at it?
I would say less successfully. So firstly, they've done an exceptionally good job at producing technical briefings on a daily basis. I think Dr. Tedros has led from the front and has given warnings at the appropriate moments, and rightly so. However, I find it utterly incredible that even today, as we're speaking, there has not been a moment where countries of the world have been convened to try and carve out a global approach to this pandemic. There was the World Health Assembly that was a brief one or so day affair in May, but nothing particularly serious was discussed or agreed at that meeting. It was not an attempt to forge a global response to the pandemic. And since then, certainly nothing has happened. I think what should have happened, and certainly this is a little bit of hindsight, but it's actually an important lesson. As soon as the public health emergency was convened, in the first week or the second week of February, there should have been an emergency meeting of the UN General Assembly. You can call an emergency session of the UN General Assembly when there's a threat to international peace and security. That should have been led by Antonio Guterres. WHO should have been absolutely central to that so that we could forge a global response. What actually happened was a public health emergency was declared, and then 195 countries around the world had to have 195 responses. And they were literally left on their own without any coordination. And I think in retrospect, that was a grave mistake.
Do you think now, August, September 2020, there's still time to revive a global approach, a coming together? Or has that moment passed?
No, it's definitely not passed. And indeed, it shouldn't just be one moment. There should be a rolling process now of global cooperation and coordination. We have this virus raging through Latin America. I mean, destroying economies. And I mean, we talk about schools in the United Kingdom. I mean, think about a generation of children and young people across Latin America whose futures are just being completely wrecked. Some of the highest death rates in the world. I mean, a real catastrophe. In the United States, we're going into an election cycle. There'll be a new government in November. Almost the whole of Capitol Hill will be cleared out, new people coming in. They're going to need international support and cooperation to help guide the US response. Still in Africa, we're seeing the epidemic rage through the continent. We absolutely need to have a way to have better global cooperation, and it needs to be done through WHO. So what I think my plea to Dr. Tedros would be, we need, if we're not going to get an emergency session of the General Assembly, we need an emergency session of the World Health Assembly, and we need it as soon as possible.
Yes, I mean, you know Dr. Tedros better than me, but I think he's been quite wounded by all the criticism, and he may not be bold enough to do what you suggest.
But he's got, I think that may well be absolutely right, and he may well be advised. I mean, WHO is a very conservative organisation, and he may well be being advised not to do something like that. But he has enormous goodwill. He has the entire medical and global health community supporting him, and it's the right thing to do. There's no other way to manage a pandemic than through a global response.
Yeah, absolutely. Anyway, let's now step back to what individual countries did, as opposed to the failure to have a really good global response. During February, as you've said, many countries, including the one we're in now, did very little. Why was there that level of inactivity for a month after the global health emergency was declared?
I think two reasons. The first is that although a pandemic was top of pretty much every Western country's national risk registers, the pandemic that was planned for was influenza. And of course, influenza is a very nasty disease, but it varies from year to year, but roughly has a mortality of about 0.1%. And that is usually absorbed in the population on an annual basis. And certainly doesn't pose any major threat to the capacity of the national health system. And I think people were thinking through the lens of influenza. And that was clearly wrong, because we knew in January that this was not influenza. So what I find very strange is that people did not pick up the fact that this was a SARS virus, that all the models for pandemic preparedness were therefore wrong, and had to be recalibrated. I think the second reason is equally unfortunate. I just don't think people understood or even believed the evidence coming out of China. And that is mysterious. Everything that has happened, Clyde, in the last 6 months was clear from the work that was in the public domain at the end of January. Everything about the importance of personal protective equipment, the risks to schools, test, trace and isolate systems, the dangers of asymptomatic spread, everything that we've been debating and struggling with, it was all there. And if people had read that work and thought about it and contacted Chinese counterparts, one of the advantages about China's system is you can literally count on the fingers of one hand who the key people are. George Gao at China CDC, Chen Wang, president of Chinese Academy of Medical Sciences. Just those two people on their own who speak fantastic English, educated in the West, you know, brilliant scientists, they would have told them, any government who contacted them, you need to prepare.
Yes. Who responded well? I mean, in terms of the sort of narrative that's developing, the East Asian countries that were more affected by SARS responded better, and within Europe, Germany is getting good marks still.
Yes, yes, it is. It is. Well, certainly Jacinda Ardern. I know New Zealand's going through a recrudescence right now.
But on a tiny scale.
But on a tiny scale, that's right, on a tiny scale. But she did very well. And her attitude, I think it's an attitude of mind. I mean, when she said, we may only have 100 cases, but Italy had 100 cases at one point, she got it exactly right. You have to act, I mean, at the early stage, we can't have the same kind of lockdowns in the future, and maybe we'll talk about that. But certainly at the very beginning, when we didn't know very much about the biology and pathology of this disease, it was the right thing to do to act decisively, and she understood that. And many governments didn't understand that. They thought that they could somehow push it away, and it wasn't going to affect them. Germany is a very interesting case study because, I mean, I think the honest thing to say is we don't fully understand everything about this disease, and it would be a very unwise person to give confident judgments yet about why one country has done well and one country hasn't. So I don't want to be that person.
I'm going to throw in the word luck here.
Yeah.
To disrupt you.
There may be. But I think there's one thing about Germany which is very interesting, and there's maybe a lesson for us here. Germany has a very illustrious history of laboratory medicine. And there is a very decentralized laboratories system across Germany, something like 170 odd labs that are a network of laboratories which are able to do the testing and the monitoring of an outbreak. In this country, we have fantastic public health expertise, but we don't have the same decentralized laboratory capacity. And that meant that we were not able to have that testing capacity that is so essential in the early part of a pandemic. We're talking about it now, but you need it in the early stages of a pandemic so that you know where the virus is and when you need to be acting decisively, whereas Germany did have that capacity. And I think that may be a lesson for us, that actually the capacity and the decentralization of laboratory services might have been the critical factor in Germany's success.
And the Robert Koch Institute gets credit too.
Absolutely. You know, the Robert Koch Institute is a fantastic jewel in the crown of European medicine, and has just demonstrated stellar leadership.
When, for some European countries, it was only taken really seriously, I think, when the disease hit Italy first hard, that's galvanized people too late, didn't it, in some other countries? Yes, and I mean it was, and certainly I know the story in the UK perhaps better than other countries, but it was only when the death rates in Lombardy were, and the admission to intensive care in Lombardy became crystal clear that the various pandemic models were revised, and when you doubled the intensive care unit admissions, then suddenly the whole NHS just collapsed. So, and that information became available in early March, around March the 5th. So I would still contend that we didn't have to wait until the Lombardy data, because the data was already there at the end of January, so I still would maintain there was a 5 or 6 week delay. But then, March the 5th, the models were changed, and then we still didn't lock down until March the 23rd. So we then wasted another 2 weeks, over 2 weeks, when the virus was literally doubling every 3 days in terms of its transmission. Now that was what led to the catastrophe in the UK.
So it's two-phase catastrophe. We ignored data in China for 6 weeks, and then when we did wake up, we then waited another 2 weeks when we shouldn't have done. And that actually was not just a UK failure, that was a failure that was mirrored across pretty much every Western European country.
Yes. And then the US is another case again, and we should mention the US because it's the world's powerhouse of medical science, but not of public health, apparently.
Well, you know, the US actually has, in the Centers for Disease Control and Prevention, the preeminent, I've just said Robert Koch Institute's the preeminent, Robert Koch is the preeminent Western European Public Health Institute, or one of them, but CDC is an incredible institution. But CDC has been eroded over recent years through various budget cuts and a political climate that has been very much to the detriment of having an agency that can really call out when there's a concern. So, you know, the US is it's a paradox. It is the world superpower in science. Second to none, and yet has, because of its libertarian political tendencies and the lack of any public health system whatsoever, it's just completely failed and is continuing to fail.
Before we talk about what happens next, second waves, or whatever you call them, I'd like to ask you how you think the world of science and medical science has performed, distinguishing it slightly from the political public health response, because as the editor of one of the leading medical journals, have you been impressed by the outpouring of research?
Well, I've never seen anything like it, Clive, and actually I must say that I have nothing but pride, actually, for the way that the international scientific community literally dropped everything and has responded in a coordinated fashion, actually. You know, governments may not have been coordinated, but the scientific community has done an unbelievable job. I mean, remember, we didn't even know this virus existed until the beginning of this year. Yes. And in the space of 6 or 7 or 8 months now, I absolutely agree that there's still an awful lot that we have to learn. But what we have learned is remarkable, and the scientific community has done an amazing job. I mean, of course there have been missteps, and of course it would be nice to be more certain about particular decisions. It would be great to have certainty about schools, about transmission in children, and so many questions still remain. But actually, it is probably the greatest scientific response to a threat that we've seen. It surpasses even the response to HIV/AIDS, which itself was stellar.
And just on a more sort of closer to home note, how does a journal like The Lancet cope when you're presumably overwhelmed with papers? How does the peer review system stand up, or does it not?
Well, I think there's a cost. And the cost has been, and of course this is the cost that we've seen mirrored in health systems, we've had to drop other things. You know, at the very beginning of this year, we had a plan that we were going to use 2020 to campaign on children's health. We launched a commission at WHO in February with Dr. Tedros called Future Child. And then everything went pear-shaped, and we haven't done anything on children from that commission this year at all. And you can mirror that across other spheres, cardiovascular disease, cancers, other infectious diseases, and so on.
And particularly mental health.
And mental health, absolutely, you're absolutely right. And so we have really, this is for the weekly journal, we have really struggled there. Now the thing that I'm very grateful for, and I don't want to plug it, the Lancet's journals here, but we have a stable of about 20 odd journals, and we do have a Lancet journal that's focused on mental health, a journal that's focused on cancer, and so on. So we have been able to keep attention on these other issues. But for the weekly journal, it became for 6 months a COVID journal. And of course, it's right that we should do that in the middle of a raging pandemic, but there are other issues that we should be turning our attention to beyond COVID. And that's my concern. We mustn't lose sight of, COVID is an acute on chronic crisis. It's an acute pandemic which is hitting a world that has a series of chronic conditions, some of which are health-related, climate-related, poverty. There's a whole set of issues. We mustn't ignore that chronic dimension that the pandemic has rested on.
Turning to the future, first of all, the next few months with COVID, and then we can talk about other pandemics caused by different viruses or pathogens that may be on their way. How do you see the next few months panning out? How do you think governments and the world should respond? And are we likely in the Northern Hemisphere to see a real upsurge of cases, second wave during the autumn and winter?
Well, we're already seeing, the terminology is imprecise, but we're seeing a resurgence in some countries already. We're seeing a resurgence in Israel, we're seeing a resurgence in New Zealand, we're seeing it in this country, we're seeing it in France, we're seeing it in Spain. And of course that's entirely to be expected because you've got clusters of outbreaks or community transmission still in a population that is largely susceptible. There isn't the immunity in the population to protect people. So it's entirely understandable as you have further social mixing that these outbreaks will occur again. And we're not going to get out of that situation, I'm afraid, until either there is sufficient immunity in the population, which isn't going to happen anytime soon, or we have a vaccine. So the race for the vaccine is a really, really, really important objective. I have my worries about that, although there are many candidates, and I think in 2021 we can expect a vaccine, one or more vaccines to be available. No vaccine is 100% effective or 100% safe or 100% given to the population. So the idea that a vaccine is going to be a magic bullet that's suddenly going to turn off this risk is not a reality. So I think that what we're going through at the moment is a renegotiation of our relationship actually with this virus. The first time our species encountered the virus, we did the right thing and locked down. That's clearly not sustainable. And now what we're going to have to do is we are going to have to take responsibility ourselves for how we act in our relationship with the virus.
You mean we as individuals?
We as individuals. This is not something we can lay on government. I think it's fine to be critical of government in the first phase because the responsibility did lie with them. But now the responsibility as much lies with our own individual behaviour. And so we have to manage our own risk. We have to take decisions about how much risk we are willing to take on ourselves. And we know enough to be able to make those decisions. Younger people are relatively safer than older people. Certain jobs are more at risk than other jobs. Certain locations, for example, in hospitals or in care homes, carry greater risk than in other locations. So there is a way that we can use the patterns of risk to inform our individual decisions. And I'm not sure that that message has actually got through yet to the general public, that now it's over to you. Government can't solve every problem. It really is up to each one of us.
If governments, I take your point completely about individuals, but if governments like the UK are to have certain objectives, one of which is not to overwhelm the health service and hospitals with cases, it looks as though that will be relatively easy to achieve because it was so unfortunate originally at the most vulnerable people in care homes. It looks as though, although there are doubts about whether enough people are being tested, etc. The proportion of cases now amongst younger people that are leading to hospitalisation is much lower. Fewer people are dying, and clinicians are learning. There may not be a miracle drug. They're learning how to manage the worst patients. So I think it would be extremely unlikely. I'm probably costly for fortune. I don't think the NHS in the UK will probably be overwhelmed, but there could still be vast suffering. And we've got to remember one thing that's emerging is the sort of long-term consequences of the disease and people who may not ever get close to death's door. The sort of long haulers. There could be a big burden of disability and mental health issues from this.
Very much so. I mean, it's, 8 months in, we don't know the long-term effects of infection at all. So, there's a lot we have to learn. I agree with you if we're thinking about Western countries, that we've learnt enough, and the pattern of the infection has evolved to the point where I don't think our NHS, our health systems are going to be overwhelmed. But there are still many countries where the health systems are being overwhelmed and can't cope. I mean, if you look at India right now, we should be very seriously concerned about what's taking place there. Africa, the two major foci of the epidemic are South Africa and Egypt. Well, you go. That's a reason for great concern as the epidemic is still increasing slowly across Africa. And again, in Latin America, people, in fact, one of the incredible things is that people are not able to use hospitals and health systems in Latin America because the systems can't cope. So it's I think this is, again, one of the lessons that governments are going to have to absorb. How do we build capacity to respond to a future pandemic? Because this isn't going to be the last pandemic that the world sees.
That's the note on which we should end, with a question. We don't know what the next pandemic will be. Disease X, it's sometimes called, but maybe COVID-19 was disease X and it's going to be disease Y. Likely to be a virus, could be another coronavirus. Presumably, for all the mistakes with this pandemic, we've learnt enough to cope with what may be an even worse, more virulent and more transmissible virus next time. Was that over-optimistic? No,
I think that's very fair. I think everybody is very sensitised now, but I think we do have to realise that the evidence has been over the last 30 years that zoonoses, zoonotic infections, infections that jump from animals to humans, have been on the rise. So that's why people have been saying we knew this was going to happen and why we know it's going to happen in the future. So how do you build resilient health systems, resilient public health systems, global warning systems, and the capacity for countries to work together, either regionally or globally, to be able to address this? There's still a lot of gaps in our system. The international health regulations are a beautiful utopia, but no country meets the international health regulations. So one of the issues that, and this is why I want countries to come together still so urgently, one of the issues we need to start talking about now is how do we plan for the next pandemic? We need to be doing that now, not waiting till next year or the year after. That needs to be happening now.
Thank you, Richard. We'll pick up on these points now, fast forwarding from late August at the Lancet office in London to Trieste. Thank you.
Thank you, Clive. It's a pleasure.
Thank you.
Well, Richard certainly has set the scene with one of the richest, most concise yet content-laden interviews I've ever done. He's with us online, but before he speaks, we're going to hear from our other four very, very distinguished public health professionals. I'm going to introduce them one by one. They're going to give a very brief reaction each to what Richard has said, picking up what they think are the key points. We start with Michel Kazachkine, who has a lifetime of service with the UN, various health bodies. He's now with the Global Commission on Drug Policy. And I shall be very interested in what Michel has to say about the global aspects of Richard's points. So, Michel.
Good morning, everyone, and good morning to my fellow panelists. Richard, thank you. This is brilliant. Thank you for this very sharp and comprehensive analysis. And Clive, I must say, I'm basically agreeing with everything Richard had said. So I'll just make a few points in complement somehow. My first point would be that maybe never until now have we seen how much health is a political issue, in both the best and the worst sense of the term. The best because politics is about making a choice against other choices. And here we've seen many countries, most countries of the world, making the choice of health against other priorities, even economic priorities. So that is a fundamental political decision, and it shows the fundamental political dimension of health. The worst, it's the politicization and the fact that political powers and tensions have taken over the multilateral dialogue. You mentioned, Richard, the inaction somehow of the UN. Let's remember what happened in the times of the AIDS crisis. The whole thing started, the mobilization of the world, the global mobilization, started with a resolution of the Security Council in 2000. In 2014, the Security Council adopted a resolution saying that the Ebola crisis is a public health threat. This time, the Security Council met. It met in March several times, and it failed to come to an agreement. And to me, this is shameful, and I think that member states who took responsibility for that failure should, in the future, in history, be held accountable for really destroying somehow the global order. My second point is that global order, which we've seen in action and successfully in the fight against AIDS, TB, malaria, is now shifting somehow. If you think retrospectively, the AIDS crisis, at least from the 90s, and certainly the Ebola crisis and some other global threats, were global, but basically they were crises in the south with solutions coming from the north. And that has shaped very much the relationships, the power games, and the way the global order and global health diplomacy have been functioning. This time, it's a 360-degree crisis. Everyone is in the same mess. No treatment, no vaccine, at least at this time, limiting our possibilities to public health measures, and solutions may well come from the south. We hear about the Chinese vaccine, the south. I hate talking about the global north and global south, but let's use that for the purpose of the discussion. We hear about the Chinese vaccine, the Russian vaccine, maybe the Brazilian, the South African vaccine. The entire order is shifting, and if we succeed in reconstructing an architecture for multilateral dialogue, it will certainly be on another and different basis than the one we've been using so far, and the one that actually has been successful for a number of other reasons also when it comes to AIDS. Maybe two more points, Clive, if I may. One is about prevention. I do agree, no doubt, with Richard that it isn't a matter of governments. It's very much a matter of individual behavior change now. And this, of course, to me, coming from the AIDS field, reminds of condoms. Yeah? You can't impose condoms, on people to wear condoms, to use condoms. What is missing in this particular crisis, I think, is the link between government decision-making and action and the individual. I haven't seen governments helping the citizens to take ownership of their decisions on changing individual behaviors. I haven't seen citizens and people associated with public health decision-making. I haven't seen much implementation research on what it is that we should do to help people change their behaviors. I've seen a very vertical sort of type of slogans. This is what you have to do because this is what the experts tell us you should do, and you have to do it. And if you don't do it, we will actually fine you or whatever. And I don't think those measures can work very much longer. We need that shift to citizen and civil society participation and ownership to public health decisions when it comes to prevention. And then on WHO, I 100% agree with everything you said. It has not been listened to when it rang the alarm bell. It has not been empowered, and it is not funded. And those countries that criticize WHO are the very same who actually do not give any power to WHO. How is it that in our international system we do not have a way to verify the data that is communicated to WHO? Here I'd like to say that I'm one of the people who advocates for the ability for WHO to send independent observers to country to verify data, just as we have independent observers of the OSCE or whatever looking at the democratic way of conducting elections in countries. And the funding is a catastrophe. The entire budget for WHO is equivalent to that of the University Hospital of Geneva. So there is a fundamental hypocrisy also on the part of member states. Not only do they want to keep sovereignty on their health decisions, but also they do nothing to empower and to fund WHO. And lastly, and Clive will go into more discussion on the future, I'm hesitating about whether we will be able to reconstruct a new cooperative, multilateral architecture in a dialogue that will take into account the power shifts, the economic, the scientific, the political power shifts that have occurred in a way that decolonizes, as some people say, the current global health order that has prevailed. I was very, very pessimistic, from the start when I saw, as you did, the cacophony in our continent, Europe. But I'm now seeing signals of hope, particularly in Europe, people coming together, not only around vaccines, but around science, and a reasonable dialogue starting. So I do have hope for the future, and I think we'll have more time to discuss that later.
Thank you, Michel. Wise and powerful words indeed. We're now going to go to Latin America, where, as we've heard, the pandemic is currently raging, unfortunately. We're going to hear from Lydia Brito, who runs the UNESCO Regional Office for Sciences for Latin America and the Caribbean. Lydia, what's your view?
Thank you very much, Clive. I'm very jealous that you are in Trieste.
It's
In the
marvelous.
summer. And good morning and afternoon to all. And thank you, Richard, for bringing so important issues in the table. And just as a disclosure, I'm not a health expert. I come more from the science point of view, and that's from where I would like to comment what Richard mentioned. And the first one is definitely the response of the science systems around the world, the big and the small. They were able really to come across and try to find answers to very complex questions. And I think the fact that science responded so quickly also create an important environment that strengthened trust in science. And I think the fact that society now is listening to scientists and is really trying to follow the progress of scientific knowledge in this pandemic, it's a very positive trend. And I would say that a trend that will help us post-pandemia and also for the next ones that will come. It's also important, the building and the strengthening of the trust in science, if we want individuals to take the right decisions. And like Richard was mentioning, there is a component on this pandemic that is individual, and we do need to take decisions individually. And the fact that we are seeing a stronger trust in science and in the scientific community, it's very important. Allow me also to mention that if we want to really continue this trend, we need a few things in science. One is definitely a strengthening of science systems around the world. And we need to have that, and I'm very grateful to IASA and to ISC for having a lot of dialogues on how can we strengthen our science systems around the world to make them much more responsive to the challenges and the complex challenges that we are facing today and we will definitely face in the future. And in strengthening the science systems, there are a few issues that need also to be part of that. One is clearly, and Richard, you also mentioned that, the importance of regional and global cooperation in science. The scientific communities around the world, they have to work together in order really to find, and Michelle, you were just talking about maybe a new order and many of the solutions coming from the global south. That means that we need to work together also scientifically in order for those solutions be really global solutions and that everybody can benefit from that. And that brings me the other point of strengthening the science systems is the right to science and the benefits of to have access to the benefits of science. And that is really something that is a challenge today when you are in countries where the health systems are not capable of really taking care of everybody. But it's going also to be important in the future when we are talking about vaccines and treatments and so on. So it's also part of this discussion on science to make sure that the right to science, the right of everybody to access the benefits of science be part of this discussion. And just two more points in science that for me it's also part of the experience and what we have been living here. It's the science advice mechanisms that country have. Clive, you were mentioning how bad Latin America and the Americans in general have been hit by the pandemic. I live in the country, in Uruguay, where it's probably the very few countries that have done quite well in managing the crisis. And one of the reasons, in my view, is because the government, the new elected government, just created a scientific advisory committee that works side by side with the government and with the society to really find ways of making the Uruguayans safe. And I think that many other countries that really use the knowledge that the scientific community could bring to them in the decision-making process, and also allowed these scientific communities to talk to the society, strengthening this interface between science, policy, and society. Those are the countries that really could manage and could avoid a very big impact. And finally, and talking about scientific cooperation, I would say that more than any other time, we really need to talk about science diplomacy. We really need to make sure that when we discuss agreements, we also discuss agreements and how can we build scientific collaboration, open science, a very important aspect of UNESCO work. How can we make sure that we create systems where science is really a crucial part of the investments that governments do, knowing that we need scientific evidence to really, really, really take the right decisions in difficult and complex times. So thank you very much, Richard, again for this, and Clive, back to you. Thanks.
Well, thank you, Lydia. I agree completely with your powerful plea for better coordinated and better funded global science and science diplomacy. And talking of science, we're honored now to go to Japan for Michinari Hamaguchi's response. He is president of one of the world's great research agencies, the Japanese Science and Technology Agency. Michinari, please.
Well, thank you. Good morning, excellent participant. I'm Michinari Hamaguchi from Japan Science Technology Agency. Let me express my heartfelt thanks to the session organizers for inviting me to this conversation. And I would like to express my great sympathy for those who is still suffering from the disease. And thank you also for the excellent talk, Richard. Regarding the situation of Japan, the impact from COVID-19 has still remained relatively small, very small, I would say. As of the end of August in Japan, the number of infected people per million was 536, and the number of deaths per million was only 10. Total deaths number of the deaths people is 1,300 in Japan. This is approximately 1/10 of the world average, I think. From this fact, Foreign Policy, an American magazine, described Japan's situation as a mysterious success because the Japanese government has not enforced, but just requested gently to the citizens to stay at home. The government request is very simple, and we try to avoid overwhelming hospitals by concentrating resources on cluster intervention while tolerating some leakage of capture. Citizens were informed of the risks, and the most effective method to prevent the spread of infection. These points are carefully, repeatedly informed to the citizen. For example, we announced avoid 3C, avoid closed spaces, avoid crowded places, avoid close contact setting. 3 C's is important. also wear mask. In my case, this mask is very special because this mask is covered by antibody against COVID-19. This mask can prevent infection. Believe me, it is really effective. It's also important, I would say, well-established health insurance system is a critical part of this crisis prevention, as Richard said. In our case, everybody can access enough medical resources in every way. This is an essential line. And another important point I would like to emphasize is education. Education is very important. Education can minimize the stress and minimize the risk. Everybody should have the equal opportunity to access education. It is difficult to summarize it if each country has been dealt with this situation well or not. But for me, what is important is prompt sharing of scientific knowledge internationally, as well as inside Japan, based on 3 principles. One is transparency. At the initial stage, we don't have enough transparency of the information. We need it. And fairness and inclusiveness. Inclusiveness also includes education. I know the development of vaccine is an urgent task, but in my case, we call it Plan B. Vaccine and drug is essential part for this disease, so we call it Plan A. But I also think we need Plan B. Besides vaccine and drug, we should continue to explore a range of research areas, including material sciences, like this one, information technologies, mechanical engineering, robot, social science, and more. In our case, we have 80% uncle. He's very famous in Japan because he announced if we avoid contact 80%, then we can diminish the disease. It's based on information technology. He analyzed, and this is a well-known method in Japan, actually. I think we need to create an open platform where countries can take in good things from each other. We should communicate good things, good method. And it should be cheap and accessible from all the people. We have to invent things with our modern technology. Besides vaccine and drug, we can try many things. I think so. I believe that's the lesson we learned from this pandemic. I realize again that the most important idea is science should contribute to global well-being. It is the first pillar of the declaration adopted as the World Science Forum last year. So we should offer the chance to everybody. To make it possible, we need a wide range of methods that clean up the air, clean the water, supply the clean food, everything. We can try everything anyway. Thank you very much.
Well, thank you very much. You made some fascinating points. I love your magic mask. Just very briefly, what is it coated with?
Pardon?
What you said your mask your special mask is coated with something.
This is covered with antibody made by ostrich egg. You can't believe, but ostrich can produce huge amount of antibody. And
Gosh.
when we immunize ostrich, we don't care much. We don't need to care much about their health. Just immunize.
Thank you. Absolutely fascinating. And our last response, but certainly not the least, is going to come from South Africa, from Salim Abdul Karim, who chairs South Africa's COVID-19 Ministerial Advisory Committee and also has a wonderful background in medical science and research. So, Salim.
Thank you very much, Clive. Very good morning to you and all of the attendees. It's indeed a great pleasure to have this opportunity to comment. I really appreciated Richard's comments. I think they hit the mark in so many different ways. And as I reflected on his various comments, I think they highlighted for me, in a very systematic way, many of the challenges that we have faced in South Africa. And as I serve on the Coronavirus Task Force for Africa, as we've been grappling with this country by country, and and anybody who thinks there's easy solutions is not dealing with the real world, because there are many complexities. So I hope I can just briefly highlight 2 points, 3 points, if I might, from Richard's comments with some slides. In that, when I think about a 9/11 moment, when you first told me the title, my immediate reaction was, well, please don't invade anybody, because the last time we had a 9/11 event, we had a situation which led to a crisis. And when I think about the immediate reactions we saw here, it was to blame China, it was to blame the WHO, and blame, deflecting and blaming doesn't really help in this particular epidemic. Instead, we've got to find solutions. And I'm just providing here the graph of the epidemic in South Africa as we look at the cases, the admissions, and the deaths. And you can see how the epidemic has grown, reached a peak, and declined in a very rapid and systematic way. And this is readily doable, and you can, in fact, flatten quite a bit of that curve. And in South Africa, we were able to postpone that curve by about 2 months or so in order to better prepare. So we had our field hospitals, we had our oxygen supply, but all of that was driven because we didn't try to blame anyone, we didn't try to deflect, we dealt with the problem. And we took early action. Within 10 days of the first case, we declared a state of disaster. We implemented a range of measures to prohibit gatherings, reduce international travel, and within a few days, we went into a lockdown. And all of that was driven by the need for early action in the presence of a lack of total clarity about what to do. But despite all of that, we maintained the importance of science. We took a scientific approach. We acknowledged we had a problem, and we took a scientific approach that provided us with a path forward in dealing with this problem, so that we were not completely at sea. I mean, there's always going to be debate, and there'll always be those who want to take a different path, but it's important we explore all paths, and we provide a rationale for the path that we have chosen. And I'll end off with, for me, what has been resonating very strongly with all the panelists here this morning, in that I strongly agree with them that we're going to face next year with some real key challenges. And part of that is, as we live with this virus, we need to be cognizant that we need to be preparing for the next waves, and we're seeing that already in many countries, Spain being a good example of the real challenges of a second surge. But in the course of all of this, it's not merely that we've got to deal with the medical issues in preparing. We've got to deal with a range of challenges. And I've just highlighted here how severe this problem has been at an economic level, and how it has exacerbated, and how it has brought into sharp relief the fault lines in our society. Those fault lines have created whole new classes of divide. For example, those with access to internet and those without. And as it's dividing those lines and creating new challenges we face in societies, it's really concerning to me when I see how the rich are getting so much richer. Those who are in the stock markets are getting enormous stock market wealth, while we have huge unemployment and growing unemployment. So how do we bridge those divides, for me, is going to be important. And how we bridge the divides and our inequities is going to be important. They've always existed, and we've been trying to grapple with, but we have a moment. This is a moment not merely to deal with a virus, but it's to deal with the underlying issues that make this virus and this epidemic more severe. And the affordability of healthcare being key in driving one of the key things in the outcomes of this epidemic, which is death. And I want to end off on the note that we've touched upon here, that COVID-19 is just a warning bell of worse to come. And as we think about how we prepare, not just for a second surge, but for new pandemics, is the importance of building global governance for public health, ensuring we have authority that is able to take all of us together to build on the science base, to build public health surveillance, and to create and ensure we have a strong public health response. Because ultimately, we're going to have to ensure that we fight the little flames that will emerge wherever they occur, in China, in the Middle East, as we saw with MERS, anywhere, that we've got to fight those flames effectively. Otherwise, we're going to be dealing with huge fires and infernos. And on that note, I just want to end off by saying that, for me, it has been, an education to see how we can deal with this at a society level, and how we have had to pivot our prevention. And Richard described it very well. We pivoted from government taking initial response, because that's its duty, that's its responsibility. But it has to facilitate that transition in pivoting the paradigm to creating individuals with agency to protect themselves. Thank you very much.
Thank you. That was a wonderful sort of final response. I love the image, which is so true, of COVID-19 is just a warning bell for worse to come. Now, Richard, you have had such a myriad of interesting responses to our initial interview, all basically agreeing with you. I'm going to let you pick out, as I think I said I would, whatever you fancy from what our sort of respondents have brought up. Over to you, Richard.
Well, Clive, thank you very much, and it's wonderful to see you and to see friends on the screen here. I'm so sorry we're not together, and I hope one day we can meet as we once met before. I'd like to pick up several themes from the excellent comments that we've just heard, and I will be brief. First, the issue, and Salim mentioned this in his remarks, the issue of health systems. As David Heyman puts so eloquently, global health security depends upon individual health security, which means universal health coverage. Under Dr. Tedros, the World Health Organization rightly made universal health coverage one of its overarching objectives for his current term. And in their strategy, they set the ambitious target of an additional 1 billion people having access to universal health coverage by 2023. The most recent evidence that we've published on universal health coverage shows that that target will not be met. The world is in a very bad situation when it comes to access to universal health coverage. Specifically, 3.1 billion people, 3.1 billion of our fellow citizens on this planet do not have access to effective universal health coverage. And that is one of the greatest threats to our collective health security. One of the lessons of COVID-19 is that we have to redouble our efforts and garner political commitment for the objective of universal health coverage. And this leads me on to a second point. One of the reasons that health systems have not been able to keep pace with providing access to universal health coverage is the growing additional pandemic of non-communicable diseases. And of course, we have seen the complex interactions between non-communicable diseases and COVID-19 in this pandemic. The way we do global health does not help. We put diseases into categories and then have programs to address those individual categories. But it's the interaction between diseases that can be so powerful and toxic. And right now, yesterday, we published the latest report on the state of non-communicable diseases in the world, NCD Countdown, in collaboration with the World Health Organization. And although premature mortality from non-communicable diseases is declining in most countries, the pace of change is just too slow. And it is much too slow if we are serious about achieving Sustainable Development Goal Target 3.4. No country is going to meet that target at present rates of progress. And so, in addition to focusing on universal health coverage, we need to have a particular attention to addressing non-communicable diseases. And the final point I would like to make is the relationship between science and politics. Several of our commentators, Michelle, Lydia, emphasized the importance that we've attached to health as a political issue and the importance of science for society. But something strange has happened in the relationship between science and politics. Our politicians continuously say that they are being guided by the science. And I'm glad that our politicians are being guided by the science. But we don't elect scientists to lead countries. We elect politicians to lead countries. And we need the vision from politicians and strategies from politicians to take our societies to a better place. It's not going to be scientists who are going to do that. And right now, my concern is that there is a vacuum in many countries of political leadership to take our societies to that better place, to provide that vision, to provide those strategies. And we can do no better in formulating those strategies than to listen to the voices of those who have borne the brunt of the pandemic. And those who have borne the brunt of the pandemic are the key workers in society who literally kept our communities alive while the rest of us stayed at home. People who were on the front line of healthcare, people who were running transportation systems, teachers who were in schools, people who were maintaining food distribution and delivery. These are some of the lowest paid workers in our society. They're some of the workers who are least recognized and rewarded in our society. And they were the ones on the front lines, particularly at risk of this infection. And the best we can do is to pay respect to those by listening to their stories and by putting them center stage in rebuilding our communities and rebuilding our societies. Thank you very much, Clive.
Oh, thank you, Richard. You made some fascinating additional points. We've only got 10 minutes left, and there are so many things I could pull out, but I think what I'd like to do in the remaining time is ask each of you very briefly, perhaps starting with Michelle, what form of global health governance specifically should we be setting up? We've heard about how the WHO tried valiantly but wasn't properly funded or listened to, how the UN didn't rise to the occasion, how there wasn't a sort of global meeting. What form of global health governance would you advocate, more specifically? Michelle.
Thank you, Clive. A form of governance that is based on the premises that if you're a minister of health of your country, your duty is to protect the health of your citizens, but it's also to contribute to building a better health for the world. Just as a modern diplomat is not only defending the interests of his countries, but also has to contribute to the global safety and security of the world. That commitment at this time is missing. There's a strong trend of people looking inwards. And that would imply that countries in a new governance would give up on some of their sovereignty in terms of health, to which they're so attached at this time. Countries have not been given anything out and keeping their sovereignty. And that's why we can't verify the accuracy of information that our colleague from Japan mentioned, the transparency. That's why we couldn't have the information circulate. The lack also of those structures will prevent the circulation of global goods. So giving up some of our sovereignty to build a new governance, and a new governance that will also move out of the order that was built after World War II and which was so much inspired, you know, somewhere by the Americans and the lessons from World War II, but an order that takes into account the new power shifts and the new economic and societal realities across the world. That requires a huge effort, but perhaps health is a good port of entry there. And to me, the fact that the Security Council failed to agree, and there was no meeting of the UN General Assembly on COVID as we had on Ebola or we had on AIDS, but that the World Health Assembly, despite the divisions in May, adopted by consensus a resolution saying we all agree on the need for an independent panel to look at what has happened and help us understand the lessons, I think is a very positive signal. So maybe health is a good port of entry to rebuilding multilateralism and global cooperation.
Thank you. I would agree with that. I'm sure everyone will. Lydia, from a more scientific point of view, how would you see the sort of emergence of the sort of governance structure that Michelle was talking about?
Thank you very much. And I share the dream with Michelle. So, and maybe, Richard, we need to have more scientists running for political posts. But in a serious note, I do think that science really will have to contribute also to these new governance models and also this idea of better health systems, because I think part of the problem, and I think Salim and then you, Richard, again mentioned that many of the scientific evidence on individual health and our state of health individually are so well known, and we know that we don't eat well, we know that a lot of our lifestyles are not the right ones to build our immune systems, but we continue to put people into medical systems and drugs and whatever, instead of talking about a better health styles for us as a whole and for the global health. So I would say, Clive, that I hope that as we think or rethink our health systems and also health systems governance, that we can indeed engage scientists in that process of thinking, because they could bring ideas, evidence, and innovations that would probably ensure a more strategic and a more visionary view on the health issues that Richard was mentioning about. So I still believe that science has a role to play in decision making, even when they are at the core of a political decision. Thank you.
Thank you. Missionary, do you have, how do you think science can contribute to the new global governance and health that everyone's been calling for? More global collaboration?
We are now living in a kind of separation era. Each country wants to be independent and somehow denying collaboration. And I think science is only one universal word we can accept and agree. So science can connect people. We should work together through science, and we can make it. This is my message. Thank you.
Oh, thank you. Salim, the same question to you. I know it's something you've been thinking a lot about.
Certainly, Clive. You know, for me, our challenge in global governance is not that we don't have a structure, or we don't have processes, or we don't have a UN. What's broken in our effort to create this is our belief system. We have a broken belief system where people believe I can be safe when you are not safe. That, for me, is a fundamental failure of a belief system. We have an incorrect starting point. Our paradigm is built on a fundamental premise that is wrong. And we can only fix global governance if we fix the belief that our futures, not as nations, but as a globe, is fundamentally intertwined. I am only safe when you are safe. That means that we see the importance of the we, of our collective good. And that, for me, is fundamental. We've got to build that paradigm, we've got to build that belief system, and then the governance follows. I might be a dreamer.
It's a wonderful dream. I love that. I'm only safe when you are safe. Richard, you are going to have the last word. We've got a minute or so left. I'm sorry we didn't have time for Q&A, but everything everyone said was just brilliant. I've enjoyed your thoughts so much. Last word, Richard.
Very quickly, I agree with Salim. We've got many of the structures. I agree with Michelle that we need to reform Bretton Woods institutions. But very importantly, we need to bring our American friends back into the international community. And November the 3rd is going to be a critical moment, not just for the United States of America, but for the entire world, because we need America as a strong partner in multilateral arrangements. And America currently has gone rogue. All of us on this panel, everybody listening, has friends in the United States. We need a strong America as a partner. And one final point, regional leadership is going to be even more important in the future. We have seen Asia Pacific do relatively well compared with other parts of the world. The Pan American Health Organization is in crisis because it doesn't have proper funding, and we need strong regional leadership in Latin America. All regions of the world have an important part to play here, and I'll stop.
Thank you so much, Richard, for giving us your time in London and then here. And to my other panelists, you were all absolutely brilliant, so much to think about. Again, sorry to those who wanted to ask questions, but we just didn't have time. Anyway, thanks all and farewell from Trieste.
Thank you.
Thanks, everyone. Bye.
Thank you.
It was very good. It didn't turn out as I'd expected.